Hello. If you're suffering from ulcerative colitis, Crohn's disease, irritable bowel syndrome, celiac disease, IBS or irritable bowel syndrome, then this brief webinar on digestive disorders will mean a lot to you. I'm Dr. Gregory Kramer, chiropractic physician. I've been in practice for over 20 years, and I'm affiliated with Functional Medicine University, and therefore I've had advanced training in functional medicine and clinical nutrition. I'm going to cover the problems, causes, and solutions with these digestive disorders. We will use the name of the disease like Crohn's, ulcerative colitis, IBS or irritable bowel syndrome, reflux, heartburn or GERD, or celiac disease collectively under the term digestive disorders. Many of my patients tell me they have pain after they eat, they have bloating, they alternate between constipation and diarrhea. Some of you might be suffering with diarrhea so frequently that you're afraid to leave the house. I have patients that can't digest any food, that even under a gluten-free diet, they're still having problems. Some type of bloating, some type of pain, constipation, diarrhea. Their energy is poor because they're not absorbing nutrition. They feel like their food is coming up through their stomach. If you are suffering with these problems, then you are not alone. Some of my patients tell me they've had these problems for years, some of them even decades. Many of my patients have been to some large institutions like the Mayo Clinic, the Cleveland Clinic, University of Michigan, and obviously if they've come to see me, none of that has worked. The reason we're able to help the majority of these problems is two. We're comprehensive and we address the root cause. So if you're sick and tired of being sick and tired, then this information I believe will help you a lot. But first, you must be willing to understand one basic concept. It doesn't take a rocket scientist to figure out that if what you're doing is working, then keep doing it. Also, if it's not working, that you must change. If you keep doing the same thing but expect a different result, that's called insanity. So if you're on more and more medication and having more and more health problems, you must try something different. So what causes these digestive disorders? Well, there's multiple factors. We're going to use the term an iceberg analogy to explain the root cause. The tip of the iceberg is the smallest part of the iceberg, and that represents the name of your disease. It could be ulcerative colitis or Crohn's disease, irritable bowel syndrome, GERD, celiac disease. You've been seeing experts in disease management. And if that's obviously worked, you would not be watching this video. I don't treat disease at all. In fact, there's a common saying in clinical nutrition and functional medicine that we don't treat disease, we treat the cause, or then the person that has the disease. What does that mean? 5 people with the same disease could have 5 different causes. Each and every one of you has had a different physical, chemical, and emotional stress background in your life. Therefore, I believe you should be treated as an individual, not as a label. Now, what I do is I address the cause of the problem, which is represented by the base of the iceberg. Remember, the base of the iceberg is the largest part of the iceberg, and that's what sunk the Titanic. The base of the iceberg is the cause of your problem. It represents the physiological glitches, the errors in energy metabolism. This is the root cause of your health problem. Now, what are these root causes? Well, there's many of them. An example would be, some of them could be, you could have a deficiency in digestive enzymes. In fact, I know it's counterintuitive, but if you have burning in your stomach, there's a high probability that you're going to have low stomach acid. And when you have low stomach acid, the food is not digested and it sits there and rots. And that's what creates that inflamed gastric mucosa. You could have a nutritional deficiency or a heavy metal toxicity. You could have an imbalance in bacteria called dysbiosis, which is very, very common in anyone suffering with celiac disease, anyone suffering with irritable bowel syndrome, if you have trouble with constipation or diarrhea. You could have an autoimmune imbalance. In other words, your immune system is out of control and it's attacking your intestines. And that's very common a factor in people with Crohn's disease, ulcerative colitis. And what causes your immune system to go out of balance? Well, there's 2 major factors that needs to be looked at. Number one, do you have a food sensitivity? Are you eating foods that create inflammation and are irritating your immune system? Number two, you could have a gut bug, chronic bacteria, viral, fungus, or yeast problems that could constantly drive the immune system. Chronic bacterial infections are a high probability of anyone that has trouble with reflux, GERD, or burning in the stomach. You could have a detoxification error. You could have an absorption issue where even if you have the right nutrients, your body cannot absorb them. You can have a neurological imbalance where one part of the brain is firing stronger than the other part. You can have a hyperactive nervous system caused from a spinal problem. This is easily sensed if you've ever been nervous and you notice that your stomach or colon gets worse. That's an example how your nervous system plays a role in your digestive disorders. There are many different factors that need to be looked at. In order to get at the root cause, we must test you using science-based lab testing. I know many of you have had tests before, and many of my patients tell me they've had tests and they've had a variety of different lab work, and the doctor says everything's normal, or they give them the name of their disease, but they're still getting worse. I'm here to tell you, if you're getting worse, then something's been missed. We have to use more sophisticated testing. It's not that your tests were poor, but we have to find out the root cause in order to address your unique or individual solution. And so what is the solution to these digestive disorders? Number one, we have to find the correct problem. An example would be if you have a digestive problem, an absorption issue, an immune system imbalance, we have to address those. Another person with the same disease could have a nutritional deficiency, an imbalance in bacteria, and an autoimmune imbalance, and we have to address those. Whatever is your unique weakness, we have to address. And the majority of the problems that we see with digestion, whether it's ulcerative colitis, Crohn's disease, irritable bowel syndrome, GERD, reflux, celiac disease, most of these can be helped with a non-drug, non-surgical approach. If these problems are interfering with your life and this information makes sense to you, then I suggest you give us a call at 248-615-1533 for a free 30-minute consultation. You'll sit with me, we'll meet in a relaxed environment, bring in your lab work, bring in all your tests, and we'll sit down to see if you qualify for our natural recovery program. Remember, if what you're doing is not working, you must do something different. So if looking at the root cause and being comprehensive makes sense to you, please give us a call, and then we'll see whether or not we can help you. If I can help you, I'll tell you. If I can't, I'll tell you that too. I look forward to seeing you at a consult. Yours in health, I'm Dr. Gregory Kramer.